Good afternoon, everyone. Thank you for joining me today. Hello, my name is Dr. Shayla Toombs-Withers. I am a family physician here at Essence of Health Wellness Clinic. So, we are still in the midst of the coronavirus pandemic, worldwide actually. And so today I wanted to share with you more information regarding how to keep you and your families both healthy and informed in the midst of this pandemic. So first, I want to just update you on where we are, on some statistics in terms of where we are with the coronavirus. So here in the United States, and these statistics have come from the Centers for Disease Control and Prevention, the CDC, and these are as of yesterday. They have not updated as of yet with today's statistics. But as of yesterday, in the United States, there are total positive cases of 68,440 positive cases. We have had here in the U.S. 994 deaths thus far from the coronavirus. In terms of the highest numbers of positive cases right now, those states are New York, Georgia, Florida, Louisiana, Washington, California, and Colorado. Now, regarding us here in Tennessee and here in Chattanooga, Hamilton County, so here in Tennessee, particularly in the state, we have 957 total positive cases. And as I told you guys last week, surprisingly, the highest number of positive cases that we have had is actually in the age group ranging from 21 to 60. So it's not so much that more elderly population as we initially thought with this virus, but currently the hardest hit age group is ranging from 21 to 60, with 713 of the positive cases in Tennessee. So 713 of those 957 total cases. Now, in terms of a county breakdown, here in Tennessee, our top three counties with the highest number of cases are Davidson County, currently with 203 positive cases, Shelby County with 147 positive cases, and Williamson County with 70 cases. Now, in terms of Hamilton County, here where we are in Chattanooga, we are currently at 28 positive cases for coronavirus. So, because we know that this virus is still spreading and people are still getting infected, I did want to discuss with folks to learn how we actually test for coronavirus. So initially, when we first started testing was only available if you were in the hospital, but now we have more accessibility to testing. So many of your outpatient primary care practices are able to provide testing. Here at Essence of Health Wellness Clinic, we are able to provide testing to our patients. We are still looking out for those symptoms, including cough, fever, and shortness of breath in terms of who we test. And we're also looking for things like if you fall into a high risk category in terms of contacts or in terms of your health conditions. So those are some things to keep in mind. So in terms of how we test, I've got a few things here to show you all. And so there are a couple of ways to test, and then the ways that we do the test, some of it will be determined by the lab that your physician or your provider may use, because certain labs require certain techniques and require certain types of specimens. So some of that will be determined by that. But there are currently several ways that tests can be performed. So the most common one that a lot of people have probably seen on the internet thus far is the nasopharyngeal swab. And so the swab looks like this. As you can see, it's kind of thin, but it is a long swab. And so this is a swab that we usually use for flu testing. And so the way that this swab works, I'm going to turn my head so you can see. And so when your provider swabs you, they're going to go through your nostril. But the idea is, the reason the swab is so long, because the idea is to get that area in the posterior area of your nose area. That's the nasopharyngeal area. And so they will insert the swab through your nose to get that area, and they will swab each nostril, and then they will place that swab in a medium similar to this. This is called a viral medium, and then they will get that sent to the lab. Now, there's another way that this testing can be performed, and it's called oropharyngeal method. And that's what these swabs are. So these are slightly larger than the nasopharyngeal swab, which was that long skinny swab. So with the oropharyngeal swabs, the way this works is similar to those folks who may have had a strep throat test before. And so you just open your mouth really widely, and they will use that swab to swab the back of your throat, similar to the method that's used with strep throat. And then once again, it will still go into this viral medium to be sent away to the lab for your testing. Now, there are a couple of other methods that can be used, and one is called a nasopharyngeal wash or a nasopharyngeal aspirate. And so the way that one works is your provider will use one of these syringes like this. Of course, the needle will be taken off. We aren't inserting needles into your nose. But they'll use a syringe, and what they'll do with the syringe is draw up some normal saline, which is pretty much similar to like a sterile water, but it's normal saline. So they'll draw up some of that, about 2 milliliters of that. You can see the numbers on here. And then what they'll have you do is lean back. They'll insert that solution into one of your nostrils, and then using a sterile cup, these are like urine cups, but any type of sterile cup, clean, dry container can be used. And then once they insert that solution, they'll have you lean forward and have that solution rinse into the cup. And so then that will be performed on both nostrils to obtain the sample into the cup. And so that's a nasopharyngeal wash. Now, if a nasopharyngeal aspirate is performed, it's a similar procedure. However, the provider will then attach a small tube. They'll take this needle off once again, but they'll attach a small tube to insert into your nostril to be able to just remove that solution material that's inserted into there that way. And so these are a couple of ways that the test is actually performed. Now, there are a couple of other ways that it can be performed, and these ways are things that they're typically doing in the hospitals. And so these are called bronchial washings or bronchial lavage. And that's a much more invasive type procedure. And so those things are typically will be performed in the hospital and not something that your outpatient provider would be doing. And so that's how the testing is performed. Now, in terms of once the testing is performed, what does that mean? So the way this is being resulted is your provider will then receive a result of positive or negative. And so a positive result means that you have the infection, that you have been infected with coronavirus. However, on the other hand, a negative result does not necessarily mean that you don't have the coronavirus. A negative result can actually mean a number of things. As we know, coronavirus, some people may not become symptomatic of it between this period of 2 to 14 days, or they may not be shedding enough of the virus to actually be detected within that time frame. So depending upon when you're testing, when you're tested, you may not have enough of the virus to actually be detected at that time. So just because your test is negative doesn't necessarily mean you're safe, you're good to go, do what you were doing, because you still may have it. Some other reasons that your test could be negative is that when you were infected or when you had come into contact with the virus, your body may not have produced enough of an immune response also for it to be detected within the test, because that can play a part in this. And then another factor is, how was the test performed? And so now there is evidence that's coming out that some of the specimens, so we talked about those different ways that you can collect specimen, some of the specimens are more accurate than others. And so that can determine too, in terms of why a test may have been negative. And so the CDC has put out some more recent recommendations in terms of, actually, if a test is negative and you've been tested, you should have 2 negative tests to really say that it's a true negative and that you may not be infected with the coronavirus. Now, so really it's boiling back down to washing your hands and staying inside. And so I wanted to give you some tips. I know for many of us now, people have been inside, probably going into their second or third week at this point. So how to stay healthy when you're inside. So a couple of things. So one, boost your immune system. Ways that you can do that are with some supplements. So vitamin C, zinc, those things have been shown to be immune boosting supplements. You can find these a lot in your multivitamins. You can get chewable vitamin C. You can find some of these emergency cold preps will sometimes have some of these immune boosting supplements in them. So that's one way of boosting your immune system while you're home. Also, fruits and vegetables. So once again, when we eat those naturally unprocessed foods, fruits and vegetables, especially the more colorful fruits and vegetables that we get, we'll naturally get more vitamin C into our bodies, and that actually helps to boost our immune system and fight off infections and viruses such as coronavirus. Also, one thing that's important is to limit your processed snacks. So I know when we're inside a lot, we tend to eat more snacks because it's there. We feel bored. We don't feel like we have much to do, but try to limit the amount of processed snacks that you're eating, because the more processed foods you eat, it does tend to lessen your body's ability to fight off things, because your body, it's not as healthy as it would be from eating those unprocessed foods. Tip 2 is to get some exercise. So some people, may think, well, I can't get outside. I can't go to the gym. It's closed. You usually walk the mall. You can't do that because you don't want to be in the crowds. But there are some great ways out there to get some exercise, because it can be good for your health and keeping you healthy during your self-quarantine. So if you are immunocompromised, so if you're one of those individuals who have one of those high-risk conditions for coronavirus, if you are a patient who may be suffering cancer or kidney failure, or a number of things that may weaken your immune system, I wouldn't suggest you go outside for exercise. I would suggest you, if you wanted to get some exercise, you stay inside. There are a number of ways to get indoor exercise. YouTube has some free workouts on there. You just really search whatever you are interested in, whether that be yoga, whether that be some type of cross training activity. So YouTube is great for finding a free workout there. Instagram also, I've even seen some of the more popular gyms. So like Orange Theory has even had some free workouts through Instagram that you can find live. So there are some live streaming workouts that you can do. Some of your other streaming services, like Netflix or Hulu or whoever you subscribe to, also will have some free exercise resources there that are available to you to get some indoor movement and indoor exercise. Now, if you are not one of those immunocompromised individuals and you're not presently ill, particularly with symptoms of coronavirus, you can go outdoors for some exercise. Now, there are ways to go outdoors and things that you should think about if you are going to go outdoors for exercise. So one is to avoid any crowded area. So if there's a trail that you enjoy going on here in Chattanooga, we like to go to the pedestrian bridge. I would not recommend you go to those areas right now, because you do want to limit your interaction with others. You want to be able to keep that 6 foot of distance between yourself and any other individuals to prevent those respiratory droplets from getting on you while you're out exercising. But you can go outdoors and have some outdoor exercise. You can go jog, you can walk, you can ride your bike. When you do return indoors, or another thing, if you do go outdoors and if you go to a park, especially parents who may be taking kids to a park, be careful not to let them put their hands in their mouths while they're out there. And everyone should wash their hands immediately upon leaving those areas and immediately upon coming into your home, so that you don't bring any of those contaminants that you may have been exposed to into your home. So those are things to remember if you are going to get some outdoor exercise. Keep that 6 foot of distance, no crowded areas, and wash your hands and your clothes immediately upon your return. Now, the other tip in terms of staying healthy during your home self-quarantine is to get some rest. So we are all inundated right now with news about this virus. It's all over our television. It's on our streaming services. It's on our social media, and so we're inundated with it. So it can be anxiety producing. So one way to reduce that anxiety really is just to get some rest, turn the screen off, go meditate, pray, whatever is your thing that helps to rest and ease your mind. Remember to do that, and remember to just take time just to step away from everything and get rest, because that's also a part of being healthy while you're home during this self-quarantine. And then the final tip to this really is to discuss with your doctor when you may be able to stop yourself quarantine. So particularly if you were ill, if you had been tested for coronavirus, you are going to want to discuss that with your doctor when it may be safe for you to interact with um, other individuals, even from a standpoint of interacting with family members in your home, or going to the grocery store if you need to. You want to discuss that with your doctor regarding what are the latest recommendations and what are the safe recommendations for both yourself as well as other individuals who may come into contact with you. So those are my tips and my thoughts. Thank you all for joining me. I do want everyone to stay healthy out there. The essence of health is in you. I do continue to accept new patients even while we are home and while we are social distancing. Essence of Health Wellness Clinic is equipped for telehealth visits. We have always been equipped for telehealth visits, and I am offering appointments via video, and am accepting folks to take a part of the membership where the video visits are included in your membership package. And you still get to take advantage of those discounts on your medications and any potential lab work that you may need. So learn more at essenceofhealthwellnessclinic.com. I am also on Instagram at Essence of Health Wellness Clinic there. I think I do have a couple of questions here in the comments. Thank you all for joining me. So I will scroll through these just a moment to try to answer some of the questions. Okay, so one question was, does it hurt? I am guessing she's particularly talking about the testing. So when the testing is performed, I will say the nasopharyngeal swab does tend to burn when that testing is being performed. So it causes some discomfort. I'm not going to say that, no, it's gentle and doesn't hurt at all. It will cause some discomfort, but it's tolerable for most people. I haven't had any individuals to faint or anything where it was just intolerable to have the procedure performed to get the testing. Let's see. Just looking through if there was any other particular questions. What do you recommend to folks that believe they had and recovered from the virus before January? Do you really think there is a chance of reinfection? Will there be a test that can determine if you had the virus? So that is a great question. So yeah, there are some thoughts that people were exposed to this virus, and that this virus may have been present in the United States before we actually started testing and before we actually started seeing more individuals become ill from this virus. And so there are so in terms of answering that question, if you've had it before January, chances are that by now your immune system had fought the infection off. But in terms of reinfection, yes, there has been some reports that individuals can become reinfected. I read some reports that came out of China regarding their population, and that they did see some instances of reinfection in individuals. And will there be a test that can determine if you've had the virus? To my knowledge, right now, there is no test determining past exposure to the virus without active infection. The tests that we're currently doing are determining active infection and not so much previous exposure to the virus. And another question here is, what is the effect on pregnant women? All right, so in terms of pregnant women, the American College of Obstetrics and Gynecology, they did put out a report that pregnant women are more at risk in terms of potentially catching this virus and having more high risk from this virus. I have not seen any detailed reports in terms of why this is actually a risk beyond. We do know that when pregnant women contract viruses like the flu virus, they are more at risk of getting those complications from that virus, like pneumonia and going into respiratory failure. And so the thought is some of that same process is occurring. But because this virus is so new, I don't think any particular studies on pregnant women have been performed as of yet to definitely know what the mechanism of action is in terms of the true effects that it's having on pregnant women and why it's having those effects on pregnant women. And another question here is, can pets contract the virus? So that is a great question, and I will say initially the studies that were out there were saying that pets were not contracting the virus from their owners. However, I actually just saw something last night where supposedly there may be one case where a dog did get the virus, and the thought is that they got it from their owner who had tested positive for the virus. So that's also something that's new on the horizon. Once again, this virus being so new, there's still a lot of studies that have not been performed, or a lot of studies that are in progress to determine what all populations that may truly be affected. So in terms of pets, the verdict is still out there. Now, the recommendation though is still that you still take care of your pets, because we certainly don't want to mistreat our pets or our animals, or leave them vulnerable at a time when they may also be anxious, because they may be sensing your anxiety. So just use those same safe practices with your pets as you would with your children, making sure, if you do have a cough or fever, making sure that you are covering your mouth, not breathing directly on your pets, making sure that you wash your hands before you interact with your pets, before and after, to just decrease their potential risk of catching anything. Another question here is, will this virus pass as it gets warmer? So that's also a great question. So there is some thought that possibly that the numbers may lessen as it gets warmer, because this virus does not seem to like hot environments, in terms of we're able to wash it off of our hands and off our skin with soap and warm water. We're able to wash it off our clothes with soap and warm water. So there's some thought that it might lessen. However, I have not seen any reports that they are expecting this virus to completely go away as summer comes. And then there are some other thoughts that even if those numbers take a little bit of a dip in summer, they will likely rise again in the fall. And so once again, we compare some of this to trends that we've seen with the influenza virus, where we do tend to see less cases of influenza in the summer, but then those things do return and resurgent in the fall and winter months. So those are really great questions. So I do thank you all for joining me. And if anyone else has any more questions, feel free to leave them in the comment section of this video. I will still respond to those questions via the comment section. And stay healthy out there. Keep your distance. Stay home. Wash your hands. And remember to just relax and try to keep calm and be healthy.